Hi, it's Dr. Waymire with Dragonfly Menopause Care. This is a video I'm making for my patients for preparation for their upcoming visit. If you are coming to see me in person, you will come to my salon suites in Chanhassen. It is not your typical clinic. It is a salon where there's a lot of individual little offices in here. So you just come in the main entrance, wait in the waiting room, and send me a text that says you're here, and I will come greet you. If I'm seeing you for an online visit, you should have received an email and a text message that have information about setting up with Zoom. And it might be helpful to set that up before our visit time because sometimes there's a little bit of glitch that might happen that will prevent us from starting on time as we plan. Now, once you come back or I start seeing you on Zoom, we are going to review all of your questionnaires. So thank you for filling those out. They actually really matter and they help me have a sense of who you are before I see you. But we will talk through all of them. And then as we go, I will be formulating a plan in my mind about what is going on and what we might need to do to further evaluate the situation. Sometimes we do need to do blood work at your first visit or salivary testing. Salivary testing is a really neat at-home way to test hormones specifically, and that might be your estrogen, progesterone, or testosterone levels, or it might be that we need to do a little bit of blood test at home, and you can actually do that as well with a kit that I can send home with you. This little kit you just return in the mail to the lab, and then they'll send me the results. If we're doing things like estrogen, progesterone, testosterone testing, or cortisol, or DHEA testing to try to figure out why you just don't feel like yourself, there's going to be 4 little tubes in that box I just showed you, and you spit into the tube, and they use saliva to run your tests. If we need to do a little blood test, such as looking at your thyroid, or we can do a lot of blood tests with an at-home little pinprick finger poke test. And you can actually put little dots of blood on this card, 1 dot in each circle as best you can, and then they can run a lot of tests off that. If we need to do a blood draw, at this time I'm sending patients to LabCorp in Bloomington. Someday soon I hope to have my own phlebotomy team that can draw your blood for us so you don't have to go to LabCorp, so it's more convenient. Now, if we decide that the right thing for you is to start hormones, the first hormone that I usually prescribe is progesterone. That comes in the form of a capsule. And there are these little capsules. You take 1 capsule and go to bed because it can make you pretty drowsy. So it can make you almost feel unsteady. It's significant enough that I really recommend take the capsule and go to bed. Now, if you really like the capsule because it helps you sleep, as progesterone very often does, sometimes women say, hey, I really like that. Can I have a second dose, another dose? So I can have, instead of the 100 milligrams starter dose, we go up to 200 milligrams. That's pretty common because women really like the benefits of sleeping again. And so if you do take progesterone though, and you do struggle with feeling too drowsy or really bloated or just don't like it and can't adjust to it, we can switch to a transdermal form of progesterone. There are a lot of transdermal forms of hormones in estrogen, progesterone, testosterone. All of them can come in one of these little containers. You turn the bottom and then you rub the cream that comes out the top on your skin. So the next hormone that we're talking about does come in one of these little containers, and that's going to be estradiol and estriol combined. It's called Biest. That's your estrogen. So estrogen is your other hormone that I used to prescribe in the form of a patch a lot because the patch is pretty easy to use. It's quite available. Sometimes the pharmacies are out, but anyway, the patch has 1 type of estrogen in it called estradiol. Estradiol is just one of our 3 bioidentical estrogens in our body. The other one that's breast protective is called estriol, and Biest is the cream that I prefer to compound for my patients rather than using the patch because the patch only has estradiol. The Biest cream has estradiol and estriol, so it has 2 estrogens. The estriol provides protection for the breasts in the form of telling the breast tissues not to proliferate or multiply, rather to stay small. And that seems to have a breast protective effect and prevention benefit for preventing breast cancer. Now, the final hormone that I prescribe quite often is testosterone. Testosterone, again, comes in a TopiClick container, and that's used once a day, like the Biest cream and the progesterone cream. If you use the progesterone cream, testosterone is a cream that you apply to your skin every day as well. Now, if I prescribe you estrogen, progesterone, and testosterone creams, once we get your doses sorted out, which takes some time to figure out what's right for you, once we get your doses sorted out, we can actually put all three of them together in one Toppy-Click container, and then you don't have to apply multiple different creams a day. It sounds like a little bit of work, but boy, the payoff, it makes it totally worth it. Then once we get done with your visit, I'll make some recommendations, probably send you home with some testing kit or a plan to test later. And then I will ask that you review your visit within 24 hours in Charm. Charm is my electronic health record. You received an invitation to Charm when you made your visit. I can also invite you from your visit if you have not yet made your account. If you can go into Charm within 24 hours after your visit, that would be great, because then you can see the summary of all the important things that we discussed. Also, my compounding prescriptions will come from Pure Scripts. That is my favorite, beloved compounding pharmacy. Stephanie there, who runs Pure Scripts, is amazing, and she will take amazing care of you. And if I ever have any questions, she can guide me to what we can do to give you the best possible prescriptions that are available. Sometimes fun stuff like great estrogen-based skin creams and all those fun things. Also, I have a preferred app for communicating with you. So if you want to send me a message, I like to use Spruce. Spruce is the best way to reach me. If you send me a message through Spruce, which I will invite you to during your visit, it's an app that you can use and communicate with me about anything personal. It's secure and HIPAA compliant, so I do like to use Spruce to communicate with you. I'll also get back to you a lot faster if you send me a message through Spruce rather than through the electronic health record or through email, which is the last place I'm going to look for messages from patients. So I hope that this gave you a little bit of an understanding of what you might expect. I know it's a lot. Part of why I create this video for you is because I know you're going to feel like there's a lot happening at your visit, but I tell you, it is going to be worth it. We will plan a follow-up in 2 to 3 months after your visit, most likely. I really look forward to meeting you. This is going to be fun. We are going to try to get to the bottom of what's going on with you and get you feeling like yourself again. Maybe feeling better than you thought you could. Maybe some things like feeling a little younger. I don't know. I'm pretty optimistic that we can do something great for you. I really look forward to meeting you. This is going to be a lot of fun. Have a great day.